In this lecture we are going to study about the thoracic duct and the phrenic nerve. So in this picture, this green color structure, that is a thoracic duct that extend from the upper part of abdomen to the root of neck. This green color structure, this one is a thoracic duct that extend from the abdomen, traverse the thorax part, reach up to the root of neck and at the left venous angle. This green color structure is thoracic duct. Now it is the largest vessel. Area of drainage, the thoracic duct that drain the lymph from all the parts of the body. Below the diaphragm, it drains both the half of the body, but above the diaphragm, it drains the left half of the body, not the right part. So the thoracic duct drains the lymph from all of the part of the body except these five structures, except the right head and neck, right upper limb, right lung, right side of the chest wall, right side of the heart, and the right surface of liver. So thoracic duct drains all the part of the body except these five structures. Remember that: right side of the head and neck, right upper limb, right lung, and the right side of the chest wall, right side of the heart, and right surface of liver. First come to the introduction. As we discussed, it is a large lymphatic vessel. Length कितनी होगी इसकी? That is a 45 centimeter long and 0.5 centimeter width. The lymph in thoracic duct is milky white in appearance because it contains a product of fat digestion. So that's why इसका lymph का color रहेगा milky white, जिसको हम बोलेंगे काई. Okay, and the duct appears beaded. Beaded appearance होगा duct का. क्यों? क्योंकि यहाँ पे numerous valves present हैं. See in this thoracic duct gives beaded appearance because numerous valves are present. Extent, it begins from the upper end of cisterna chyli on the posterior abdominal wall. This pouch-like structure, this is the cisterna chyli. Intestinal lymph trunk from both the side drain into this cisterna chyli and it form a pouch-like structure. इसका जो upper end है वहाँ से thoracic duct begin करेगी at the level of lower border of T12 vertebrae. Then through the aortic opening, जो diaphragm में एक opening है, that is a aortic opening, उसके through ये abdo से thorax में enter करेगी. Through the aortic opening, this thoracic duct enter into the thorax. Then ये कहाँ तक extend कर रही है? Till the root of neck. And root of neck में left venous angle, लेफ्ट जुगुलर एंड द लेफ्ट सबक्लेवियन वेन के जंक्शन पे जो एंगल है, दैट इज़ अ लेफ्ट वीनस एंगल, वहाँ पे जाके ड्रेन करेगी. तो दिस इज़ द एक्सटेंट ऑफ दिस thoracic duct. कहाँ से बिगिन किया? अपर एंड ऑफ द cisterna chyli. व्हाट इज द cisterna chyli? इट इज़ अ पाउच लाइक स्ट्रक्चर इन फ्रंट ऑफ द L1 vertebrae, जिसमें दोनों साइड से राइट एंड लेफ्ट इंटेस्टाइनल लिम्फ ट्रंक आके ड्रेन होता है. that form a pouch like structure, that is a cisterna chyli. उसके upper end से start हो रही है thoracic duct at the level of lower border of T12. then enter करेगी thorax में. कैसे? diaphragm में जो aortic opening है उसके through it enter into thorax. then through the superior thoracic aperture, जो upper inlet का part है thorax का, वहाँ से ये एग्जिट करेगी thorax से, एंटर करेगी रूट ऑफ नेक में और कहाँ पे टर्मिनेट होगी? जंक्शन ऑफ द लेफ्ट इंटरनल जुगुलर वेन और लेफ्ट सबक्लेवियन वेन. So this is the termination point of thoracic duct. In this picture, again this is a sternum, and behind T1 to T12 vertebrae, this is the anterior and posterior wall of the thorax, this is the sagittal section of the thorax, and this is the diaphragm. So there is cisterna chyli, इसके upper end से start हुई थी thoracic duct, then it enter into the thorax at the level of this one here through the aortic opening. Through the aortic opening it enter into the thorax, and thorax को दो कंपार्टमेंट में डिवाइड किया है, सुपीरियर मीडियास्टिनम एंड द इंफीरियर मीडियास्टिनम. इंफीरियर मीडियास्टिनम अगेन तीन कंपार्टमेंट में डिवाइडेड है, एंटीरियर, मिडल एंड पोस्टीरियर. सो दिस thoracic duct it ascend in the thorax through this posterior mediastinum in front of the vertebrae, एंड पोस्टीरियर मीडियास्टिनम से ये एंटर करेगी सुपीरियर मीडियास्टिनम में एट द लोअर बॉर्डर ऑफ T4. इट एंटर इनटू द सुपीरियर मीडियास्टिनम एंड थ्रू द thoracic inlet या सुपीरियर thoracic aperture it enter into the root of neck. So at the level of, कहाँ से स्टार्ट हुआ है thoracic duct का बिगिन कहाँ से हुआ है? एट द लेवल ऑफ लोअर बॉर्डर ऑफ T12 vertebrae or upper end of cisterna chyli. This is the beginning of thoracic duct. Then it enter into the thorax via aortic opening of diaphragm. Then it ascend into the posterior mediastinum, then enter into the superior mediastinum, and then through the thoracic inlet it enter into the root of neck. Now codes in the brief: cisterna chyli lying in front of the bodies of L1 and L2 vertebra on the posterior abdominal wall. Then duct begin from the upper end of cisterna chyli from the abdomen at the level of the lower border of T12 vertebrae, then enter into the thorax through the aortic opening. So here this one is the aortic opening in front of the T12 vertebrae. Anteriorly there is a median arcuate ligament, and on the right side of thoracic duct there is a azygous vein. On the left side there is a aorta, and behind T12 vertebrae. Relations are important. What are the structure that lie right and left and anterior and posterior at the level of aortic opening? So anteriorly there is a median arcuate ligament, on the right azygous, on the left there is a descending aorta, and the behind there is T12 vertebrae. Then it through the aortic opening it enter into the posterior mediastinum. Here it enter into the posterior mediastinum, where right side में क्या lie करेगा? azygous vein. On the left there is a descending thoracic aorta, and behind there is a vertebrae T5 to T12. At the level of T5, it is important, at the level of T5 vertebrae thoracic duct right side को क्रॉस करके लेफ्ट में आती है. ऑन द पोस्टीरियर मीडियास्टिनम ये असेंड करती है मिड लाइन के राइट साइड में. एट द लेवल ऑफ T5 thoracic duct राइट से लेफ्ट में आएगी, क्रॉस करेगी राइट साइड से लेफ्ट साइड में. देन एट द लेवल ऑफ लोअर बॉर्डर ऑफ T4, जो T4 और मैनिब्रियोस्टर्नल जॉइंट है उनके बीच में जो इमेजिनरी लाइन है दैट डिवाइड द सुपीरियर एंड इंफीरियर मीडियास्टिनम. सो लोअर बॉर्डर ऑफ T4 के अबाव ये एंटर करेगी सुपीरियर मीडियास्टिनम में along the left side of esophagus. Then through the thoracic inlet or superior thoracic aperture it enter into the root of neck. At the level of C7, again this is important, at the level of C7, transverse process of C7 vertebrae, it form a arch, laterally. So at the root of neck it arch laterally at the level of the transverse process of C7 vertebrae. The summit of arch is lie 3 to 4 cm above the clavicle. Then the duct terminate at the left venous angle. After forming the arch, it runs down and forward and terminate at the left venous angle that lie at the level of left venous angle that formed by the left internal jugular and the left subclavian vein. So this is the course of thoracic duct. It begins at the level of the lower border of T12 vertebrae, then through the aortic opening enter into the posterior mediastinum. At the level of T5, it crosses right to left side. Above the T5, it enter into the superior mediastinum. At the level of transverse process of C7 vertebrae, it arch laterally in the root of neck and drain or terminate at the left venous angle. Now come to the relation. First, relation at the aortic opening. Anteriorly, there is a median arcuate ligament of the diaphragm. Behind, there is a T12 vertebrae. On the right side, there is a azygous vein. On the left side, there is a aorta. In the posterior mediastinum, anteriorly, sloping surface of diaphragm and the esophagus. Anteriorly, there is a esophagus and right pleural recess. Posteriorly, vertebral column, right posterior intercostal artery and terminal part of hemiazygous. On the right side, there is a azygous vein, and the left side, there is a descending thoracic aorta. In the superior mediastinum, anteriorly arch of aorta and the origin of left subclavian artery. On the right side, there is a esophagus. On the left side, there is a pleura and posteriorly vertebral column. In the neck, anteriorly, there is a carotid sheath. Anteriorly, carotid sheath lie. In the carotid sheath, there is a common carotid, jugular vein and the left vagus nerve. And posterior, there are five important relations posteriorly. First, scalenus anterior muscle along with phrenic nerve. And both these structures are covered by prevertebral layer of fascia. Second important structure, that is a left sympathetic trunk along with inferior cervical ganglion. Third, there is a vertebral artery. This one is a vertebral artery. Vertebral artery is a branch of subclavian artery. Again, the branch of subclavian artery, thyrocervical trunk with its three branches. सबक्लेवियन आर्टरी का फर्स्ट पार्ट इसके पोस्टीरियर रिलेशन में है मेन, along with its two branches. One is a vertebral artery, other one is a thyrocervical trunk. And thyrocervical trunk की तीन branches, inferior thyroid, transverse cervical and suprascapular artery also come in this posterior relation. So these five structures are important. Now what are the tributaries? There are six main tributaries that drain into the thoracic duct. First, pair of descending lymph trunk that drains right and left posterior intercostal lymph nodes from lower 6 intercostal space, right and left, both sides, posterior intercostal lymph node of lower 6 intercostal spaces. Second, pair of ascending lymph trunk that drain the upper lumbar lymph nodes. Left jugular lymph trunk that drain the left half of the head and neck. Left subclavian that draining the left upper limb. And the lymph vessels that draining the posterior intercostal lymph nodes of upper 6 intercostal space but only from the left side. Upper posterior intercostal lymph node of upper 6 intercostal space but only on the left side. And the left bronchomediastinal lymph trunk that drain the left lung and the left side of heart. So these are the 6 important tributaries of the thoracic duct. What is applied? If there is injury of thoracic duct during the lung surgery, there result in the chyle enter into the pleural cavity and produce a clinical condition, that is a chylothorax. or if there is a obstruction of the lymphatic vessels, or obstruction of the thoracic duct by the microfilarial parasite, that is a Wucheria bancrofti, that lead to chylothorax, accumulation of the lymph, chyloperitoneum, chylouria, and even the accumulation of the chyle in tunica vaginalis, that is a chylocele. So this is about the thoracic.